Hello and welcome. Today, we're diving into a fascinating, albeit uncomfortable, condition affecting the ear, Chondrodermatitis Nodularis Helicis, often shortened to CNH. We'll explore what it is, why it happens, how it's diagnosed, and what can be done about it. So, let's get started. The exact cause of CNH remains a bit of a mystery, but the leading theory points to chronic pressure or trauma to the ear. Think about sleeping on one side night after night, wearing headphones that press too tightly, or even repeated exposure to cold temperatures. These factors can compromise the blood supply to the cartilage, making it vulnerable to damage. Other possible contributing factors include sun exposure, genetics, and even underlying vascular disease. When the cartilage in the ear is subjected to repeated pressure or trauma, the blood supply can become restricted. This leads to inflammation and ultimately, tissue damage and necrosis. The body attempts to repair this damage, leading to the formation of a painful nodule. This nodule is often comprised of damaged cartilage and inflammatory cells, resulting in the characteristic tenderness and pain associated with CNH. CNH primarily affects adults, with a higher prevalence in men than in women. It's more commonly seen in people over the age of 40, likely due to the cumulative effect of years of pressure and environmental exposure. While it can occur in people of all ethnicities, some studies suggest a slightly higher incidence in individuals with fairer skin, possibly due to increased susceptibility to sun damage. The hallmark of CNH is a small, firm, and often extremely tender nodule on the helix or antihelix of the ear. This nodule is typically round or oval in shape, and usually less than 1 centimeter in diameter. The overlying skin may be red, inflamed, and sometimes ulcerated. The pain is often described as sharp, burning, or throbbing, and it's usually worse when the ear is touched or pressed against something, like a pillow during sleep. Diagnosis of CNH usually made based on a clinical examination. Your doctor will carefully examine the nodule, ask about your symptoms, and inquire about any potential contributing factors, such as sleeping habits or headphone use. In some cases, a biopsy may be performed to rule out other conditions, such as skin cancer or other inflammatory conditions. A biopsy involves taking a small sample of the tissue for microscopic examination. While there aren't distinct types of CNH, the severity and location of the nodule can vary. Some individuals may experience intense, debilitating pain, while others may only have mild discomfort. The nodule can occur on either the helix as the outer rim of the ear or the antihelix at the cartilage ridge inside the helix. These variations influence treatment choices to some extent. Treatment for CNH aims to relieve pain and promote healing. Conservative measures include using pressure, relieving pillows or cushions to avoid direct contact with the affected ear during sleep. Topical corticosteroids can help reduce inflammation and pain. In more severe cases, surgical removal of the nodule may be necessary. Other treatment options include cryotherapy of freezing the nodule, laser therapy, and even injections of corticosteroids directly into the nodule. Preventing CNH primarily involves minimizing pressure and trauma to the ears. This can be achieved by using earplugs that don't fit too tightly, avoiding sleeping on the affected side, and protecting the ears from excessive sun exposure and cold temperatures. If you wear headphones, choose models that don't press directly against the cartilage of the ear. Early intervention is key. Address any discomfort promptly to prevent the condition from worsening. The prognosis for CNH is generally good, especially with appropriate treatment. While the condition can be persistent and recurrence is possible, most individuals experience significant relief with conservative measures or surgical intervention. Recent research has explored the effectiveness of various topical treatments and less invasive surgical techniques, aiming to minimize scarring and improve patient outcomes. Ongoing studies continue to investigate the underlying causes of CNH to develop more targeted and effective prevention strategies.